everyone. Thank you so much for being here today. We are doing a demonstration today on how to take a pulse rate. My name is Tamika Younger, and I'm a registered nurse, and I'm with Central Virginia Community College, and I'm going to show you the appropriate way to take a pulse. And we're going to use, for this demonstration, our mannequin, Shim. You can call him Shim. We're going to use him for our demonstration today as we show you how to appropriately take a radial pulse. Now, first of all, I maybe should tell you a little bit about what a radial pulse is and why we would do something like this. First of all, a radial pulse is actually checking the heart rate of a person. When you check the heart rate of a person, you're wanting to make sure that it is within normal limits, within normal range. And the normal range for a pulse rate would be 60 to 100 beats per minute for an adult. When we look at taking a pulse, we're going to first of all always look at the wrist, and we're going to take the pulse on the thumb side of the wrist. So we're going to follow the thumb down until we reach what we would consider the radial artery on the thumb side of the wrist. And we're going to put two fingers. We're going to take the pads of the first two fingers and place them on that area to count the pulse. As we begin to count the pulse, we want to look at the clock and we want to count at least 60 seconds as we take this pulse. We do not want to look at the clock and stare at it, because if we stare at the clock, then we're likely to count the beats of the clock rather than the beats of the pulse. So we want to count the beats of the pulse, and we count them one by one. You will not expect the pulse to be in any set rhythm. So the pulse that you take is not going to be bump, 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 bump. Just doesn't happen like that. No one's pulse is regular, that regular. So anytime you take a pulse, you want to be sure to count each beat of that pulse. Once we've done that and we've counted that and we've made sure that that's within normal limits, then we would just record it and say that this is the pulse rate for this particular patient. So if I were taking care of Shim, I would go into Shim's room and I would say, "Hello Shim, very nice to see you today. I'm Tamika Younger and I'm going to take your pulse today." I would hold Shim's hand very steadily and I would take the first two fingers, the pads of the first two fingers, and place them on his radial artery until I can find or feel a radial pulse. When I feel that, I would just continue to count each beat as I look at the clock as well. As I'm counting for 60 seconds, if I want to, I could also count for 30 seconds and multiply by 2, and that would still give me the pulse rate for a full minute. Once I'm done with that, I would say, "Shim, thank you so much. I appreciate you allowing me to take your pulse. I hope that you have a good day." And I could then record the pulse and leave the room. So hopefully now you know how to take a radial pulse. It's not very hard, very, very simple. Anyone can do it. You just have to know and be able to locate that radial artery to be able to count that pulse. So thank you so much for coming today. I appreciate your attention, and I hope this will help you to take a pulse. Thank you.